I think what we've seen in the last couple of years is sort of a renewed interest in looking at the role of pituitary surgery in treating dogs with pituitary-dependent hyperadrenocorticism or Cushing's disease. A lot of the work has been pioneered by the folks in the Netherlands, and now in the United States, our group in Los Angeles has been doing pituitary surgery for the last 3 years. It's not going to replace or become the #1 treatment for all dogs with Cushing's, but really the role of pituitary surgery has been twofold. One has been to gain better information about the pathogenesis of Cushing's by being able to get tissue from these dogs so that we can look at things like receptor subtypes, histology, growing the tumors in cell culture, so that we can look at other medications that might be efficacious to treat these tumors. And I think the other area where surgery has really been very helpful are in dogs with really large invasive pituitary macroadenomas. Those are dogs that we knew that without intervention, either surgery or radiation therapy, their survival times were going to be quite short. So I think what we've seen with surgery is the availability of the tissue has allowed us now to look at what other medications might we use to directly treat the pituitary tumor in the first place. The drugs we use now, trilostane, an adrenal enzyme blocker, Lysidrin, an adrenolytic agent, are basically drugs that are designed to lower cortisol levels, get rid of clinical signs, and improve the quality of life of the dogs. What we're really looking at now are medications that are designed to work at the level of the pituitary. So for instance, based on work done at Utrecht and in our situation in Los Angeles, we've seen some publications looking at some novel medications. One is a drug called SOM-230 or pasireotide. This is a long-acting somatostatin analog recently approved for use in people with pituitary-dependent Cushing's. Advantages of SOM-230 really is that it really is designed to block somatostatin receptors on the surface of the tumor that are responsible not only for tumor growth, but for excess secretion of ACTH. The medication is well tolerated in dogs. Really nice study by Victor Castillo in Argentina showing efficacy and safety in treating dogs with pituitary-dependent Cushing's. Our group's looking at this medication now to treat dogs not only with Cushing's, but dogs again with these very large invasive pituitary tumors. It is a medication that has to be given as an injection, so very similar to insulin, subcutaneous injections twice a day. But we've also seen no side effects with the medication thus far, and we're accruing now a study looking at about 15 dogs with large tumors. Another medication also looked at by the group down in Argentina is a drug called Cabergoline. And Cabergoline works a little bit differently. It's a direct dopaminergic agonist. And again, we know these tumors, while expressing somatostatin receptors, also express dopamine receptors. And dopamine serves to chronically inhibit the release of ACTH from normal and abnormal pituitaries. Again, the data show that for dogs with pituitary tumors arising from the pars intermedia, the zone of the pituitary that is regulated by dopamine, not only can we get tumor shrinkage and decrease in ACTH production, but amelioration of the clinical signs of hyperadrenocorticism. So that's another nice medication. Safety seems to be quite good with the medication. It is available through online pharmacies because the drug is used to treat growth hormone secreting tumors and prolactin secreting tumors in humans. Another medication recently being looked at and recently approved in the US for people is a medication called Miphastone. And Miphastone is a drug that blocks not only the progesterone but the glucocorticoid receptor. And so what you see is that by blocking the glucocorticoid receptor, which happens very quickly, the clinical signs of Cushing's go away very rapidly. The challenge will be in using Miphastone in dogs is that because it blocks the glucocorticoid receptor and it has no effect on either the pituitary or the adrenal, we really don't have any endocrine tests to monitor efficacy. So what we really have to do is look at resolution and control of clinical signs. Miphastone versus Cabergoline versus pasireotide won't have any effect on pituitary tumor growth, however. So we're really looking at that medication as a way to control symptoms. So while I don't think pituitary surgery is going to replace medical management, I think it plays an important role in treating large invasive pituitary tumors and has played a really important role in helping us identify other drugs which may be more effective than the medications we use now.